So this course aligns a lot with what I already do with my patients, but it seemed like a good way to standardize things, put them in a controlled setting, do pre and post checks, and it looked like a very huge resource of information.
I decided to register for the course to review the anatomy, review some of the grip, GRSs, and the TSI points, but also I wanted to see how to implement Shockwave with what I'm already doing in my clinic.
The big reason was because it was advertising the Shockwave portion. My office has a Shockwave unit, and I wanted additional training specifically for like shoulder, knee, and hip. I see a lot of that in the office and felt like I was lacking the ability to get the results that I wanted. And after he sent out some of the preliminary information on like how the grip approach and stuff, I very much thought that it was a very good analysis system, and as far as like how to assess patients kind of where they were versus trying to force them to do specific movements and expecting them, like everyone to be the same.
Yeah, I registered this course in large part for me because of my own struggles with my hip and trying to avoid a total hip replacement, even though I'm relatively young. So I was hoping to gain some insight in how to really help myself and my patients as well. And yeah, it definitely is. Felt like I've come away with some tools I feel like I can make some progress.
So far, it's great. I love how everything is actionable. It's pretty much surpassed my expectations. Everything's very clear. The instructor, Dr. Fergus, he's very concise. He is obviously very experienced, and he's very good at laying things out very easily to understand.
It far exceeded my expectations. I was able to use not only a radial shockwave, but a focus shockwave, learn the correct settings based on the patient's presentation, as well as like where and when to apply.
Expectations-wise, it far surpassed what I was expecting. I definitely knew from talking with some other doctors that Dr. Benjamin Fergus was really good, very intelligent, but the practical hands-on application, the fact that I can go back home and start using this right away, very much made it more than worthwhile. I feel like I can go back and start using it right away instead of having to like practice some things a little bit more and trying to kind of refine some things. I can start using this right away.
Yeah, the course met my expectations to a large degree based on what I was looking for in it, but I was pretty surprised at how much value I think there is in the shockwave therapy. I hadn't been exposed to that very much before, but it's something I'm excited about implementing in my practice now.
Well, I can definitely implement almost everything. The only thing that I might not be able to is the shockwave portion of things, but they even, mention there are different ways to utilize some TSI points and the GRS systems as well without needing any of that technology. So, like I said, it aligns a lot with how I practice already, and these are just great tools to utilize as soon as I practice again.
Definitely using the mobilizations and the assessments. The application of the shockwave, very much I will also be using since we have one in our office already. And a good example is like the doctor that I work with we know that he has osteoarthritis in his shoulder, so it's going to be really nice to be able to take the shoulder component and start using that right away on him to start impacting his performance abilities as far as the office goes, because that's been very much a struggle over the last year, is seeing how much adjusting tends to tax his shoulder, and I'm really excited to see what we can do as far as improving that component of his practice. Definitely using the mobilizations and the assessments. The application of the shockwave, very much I will also be using since we have one in our office already. And a good example is like the doctor that I work with we know that he has osteoarthritis in his shoulder, so it's going to be really nice to be able to take the shoulder component and start using that right away on him to start impacting his performance abilities as far as the office goes, because that's been very much a struggle over the last year is seeing how much adjusting tends to tax his shoulder, and I'm really excited to see what we can do as far as improving that component of his practice.
So basically, this course is pretty all-encompassing. It works on joint aspects of rehabilitation. It touches on therapeutic exercise. It touches on assessment. It touches on even technology and modalities that will assist my patients in their recovery. So it's very well-rounded as a course.
This course is unique in that it gives you an assessment, it gives you a soft tissue intervention, it gives you a global reset strategy, a therapeutic exercise intervention, but on top of that, a modality. And you can see immediate changes from start to finish. You can see improvements in range of motion right away. You can also see reductions in pain almost immediately.
I think the grip approach and the fact that they have the Kinnis representatives here to talk with us about using the shockwave, I think are two really big pieces that set it apart. The grip approach is more unique versus some of the other ones that I've seen, where they tend to try to kind of box people into a certain kind of a movement, versus this where it's saying, okay, this is the range of movement that you have normally. Why do we see that loss? Versus trying to push you to generate that movement and then having so many complex movements to try to get you that movement back, where this is very much more a targeted approach to it. And it makes it a lot easier for you to have a test, and then here's how you treat if it's lacking in that movement.
I think it's really the complete integration of a lot of different modalities, the hands-on care, the motor control exercise, the structural interventions, the shockwave therapy is, and putting all together for a patient, particularly with that severe arthritic joint condition, that it, and with some of the nutritional help, is kind of a total package. So all of it together, I think, is greater. The sum is greater than I can't remember that phrase. The whole is greater than the sum of its parts.
I think so. And then, would you recommend this course to your colleagues?
Yeah, absolutely. I've found great value from it, and I'm going to be putting a bug in my ear from my colleague who I work with.
And then any last comments or things you'd like to add?
Yeah, the course is just great information presented in a really clean, organized way that's easy to understand and implement. So it's something I feel like I'm going to be using right away on Monday. Yeah.
Thank you.
Yes, definitely. I would recommend this course to anybody who's interested in becoming the expert on the hip, knee, or shoulder in their area.
I would 110% recommend this course to my colleagues, especially if they're looking to implement the shockwave into their current protocols, as well as if they're looking to learn more protocols to help people with osteoarthritis develop better joint health, as well as reduce their pain and improve their quality of life. I would 110% recommend this course to my colleagues, especially if they're looking to implement the shockwave into their current protocols, as well as if they're looking to learn more protocols to help people with osteoarthritis develop better joint health, as well as reduce their pain and improve their quality of life.